Okay, so hello everyone. I am Amatullah, student of TYBPT. I am here to speak on topic psychological tests. So let's begin with the introduction. So psychological tests are the tools to understand a person's mental and emotional health. These tests are helpful in identifying issues like depression, anxiety, memory problems, and behavior. In physiotherapy, we use them to treat not just the body but also the mind, important for complete recovery. So, why is it important? So, mental health is equally important as physical health in society. These tests helps in early detection of issues before they become serious. So what is psychological test? It is a standardized method to measure psychological conditions like mood, memory or stress. Can be a questionnaire, interview or task to perform. The test must be accurate, consistent and culturally suitable for patient. So let's discuss some psychometric properties. So first one is reliability. Will give same results if repeated again and again. Second, validity. Measures what it is supposed to measure. Norms. Score are compared to average population. And the last one is standardization. Some method used for every person taking the test. So let's move on to the types of psychological tests. The first one is personality test, and the second one is cognitive test, the third one is emotional test, the fourth one is behavioral test, and the fifth one is functional test. So let's talk about depression and anxiety scale. That is, first we can measure with that is PHQ-9. That is patient health questionnaire. 9 questions about feeling like sadness and tiredness. Score is from 0 to 27. The higher the score, the more the depression. Helps detect mild to severe depression. And for anxiety, we use generalized anxiety disorder. That is 7 questions about worry and fear. Scores are from 0 to 21. The higher the score, the more the anxiety. Used in both clinics and community settings. Let's discuss some patient generated measures. That in that first one is Cyclops, that is psychological outcome profile. Patient talks about problem in their own words. Very personal, not a fixed list of questions. Good to track how a person improves during therapy. So let's move on to its application in physiotherapy. That is psychological issues like stress, depression, or fear can slow physical recovery. These tests helps us understand what patients are going through emotionally. Makes our rehab plans more focused and effective for each person. So let's move on to its administration and scoring. Steps to give psychological tests. First, tell the patient why the test is important. Second, give the test a quiet and private space. Third, use simple language. Fourth, score the answer using the test's instructions. Fifth, interpret results. Higher score may mean more concern. So let's move on to the challenges and limitations that it faces. First one is language problem. Some tests may not be available in local languages. The second one is cultural difference. What's normal in one culture may not be in other culture. The third one is stigma. People may hide symptoms out of fear or shame. Fourth is trained staff. Need a proper training to use and score tests correctly. So that's it for today. Thank you.